views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Hello and welcome to a special edition of Open BXRx, BronxNet's special coverage providing you the latest information that matters to you during COVID-19, the coronavirus. I'm your host, Sonyi Lopez, and today is Tuesday, April 21st. On today's show, we'll be joined by several organizations and community members who are supporting the Bronx during these trying times. Coming up, we'll discuss how health disparities are coupled with environmental and systemic issues in communities of color during COVID-19 with Black Nurses Corner. Then, community members in the South Bronx have taken efforts into their own hands. We'll find out about the needs of the most vulnerable seniors and children in the South Bronx during this pandemic and how East Side House and Ojalá Threads are helping. After that, we'll learn more about the iPads to Hospitals initiative aiming to bridge the physical gap between sick or dying patients and their loved ones. And the U.S. Census is happening now. Stay tuned to learn about the U.S. Census 2020, participation in the Bronx so far, and how you can make sure you are counted. So please, stay tuned. Open BXRx starts now. Welcome to Open BXRx on BronxNet. I'm your host, Sonyi Lopez, inviting you to get social with us at BronxNet TV on Instagram and Twitter, and BronxNet Community Television on Facebook. Also, if you're watching us on cable, you can continue to stay up to date with our on-screen social media feeds, providing the latest COVID-19 and community updates and important headlines. The coronavirus is killing Black and Latinos in New York City at twice the rate, according to recent city preliminary data. Mayor Bill de Blasio stated that the disparity reflected long-standing and persistent economic inequalities and differences in access to healthcare. Here to discuss the impact of COVID-19 has had on minorities and underserved communities are two nurses, Shondra Brown and Janet Hill of Black Nurses Corner. Thank you, ladies, for joining us.
Thank you for having us.
To start, can we just learn a little bit about yourselves and your backgrounds in healthcare?
I am a nurse practitioner. I have over 20 years of experience in the health field. And currently my role is as a clinical nurse expert, where I educate nurses on a particular unit. I get them up to speed. I help them prep and kind of be a resource for them.
I have been a nurse since 1996. I actually started off as an LPN, took my boards for my RN license, worked in med-surg for a year, occupational health, the fire department, MTA. Then I settled on my specialty, OBGYN. I've been doing that for a number of years, antepartum, postpartum, labor delivery, float to NICU. Right now, I'm in the ambulatory care setting, OBGYN at Emory University Hospital.
So, ladies, I stumbled upon your page on Instagram, Black Nurses Corner, and I saw this post that really struck me. It was about environmental and systemic issues lined up with the high rate of COVID-19 deaths in communities of color. So if both of you want to speak about it a little more, just about how COVID-19 has impacted underserved and Black and Brown communities, just a little bit of background on that.
The point of it all is that we need more Black and Brown faces in healthcare, because when we present with symptoms, oftentimes providers downplay our symptoms. They don't listen. They tend to kind of have this kind of like just nonchalant attitude about what's occurring in front of them. They tend to forget the fact that people have asthma. People may be living in industrialized areas. They forget that nutrition is sometimes minimal in Black and Brown communities, not because we don't eat, but because there's food deserts. So if you don't have say a grocery store within, say, a 15-minute walk of your home, you're catching public transportation, therefore exposing yourself to possible virus. You are going into supermarkets, you're touching, handling, and then all of a sudden you have to carry these items either back on the bus or you're Ubering, and there's no telling who's in the Uber before you, if they've cleaned it. So it's kind of like a trickle down effect. And it really does start with not only the environment that you live in, it starts also with the hospital that you present these symptoms with. Are they listening? Are they taking you seriously? So when that happens to us, it kind of like puts us on the back burner. They're not taking us seriously. So that's kind of like just a small nuance of what COVID is to our communities. But it's so deep. I can't even just begin to get into it because we would be here for hours.
Right. Just to piggyback on what Shondra said, I mean, there's definitely implicit bias in the healthcare field. I know there was a study done where medical students of today, like 2020, they believe that Black people don't perceive pain is like a white person would, or a person of another ethnicity. They don't take us seriously. As Chandra was saying, if we had more people of color in the healthcare field, I think our concerns will be taken seriously. Even with COVID-19, it's hard for us to get testing. We complain of shortness of breath. They say, you know what, just wait, quarantine for 14 days. And when you finally come into the hospital, you're being placed on a vent. So I think that's another issue, implicit bias.
And what are some of those challenges that nurses are facing now, especially nurses of color in the field during COVID-19, that you can both speak about?
From my experience, our nurses, we tend to kind of want to live close to where we work, especially not just nurses, but just people in general. You want to live close to where you work. So if you live close to where you work, that means that maybe you have a 10-minute ride to get to work. You go to work, you expose yourself, you come home, you are living in a community of your choice, obviously, but we tend to live where we're comfortable, which may be around people like us. So not only are you exposing yourself, you're going home, you're exposing your family members, you're exposing your neighbors, because you have to go to the store, you have to get gas, you have to get your necessities, you still have to pay your bills. So for us, we tend to just put our heads down and we kind of grind it out. We kind of just do it. It's expected. We're workers. So if you have that work ethic mentality, you tend to ignore yourself. You ignore your symptoms. And then all of a sudden you come home and you can't breathe the next day.
Right. And I read somewhere that more than 30% of Hispanic and Black people are actually in the healthcare system. Like they're the ones working as essential workers in healthcare.
Right.
So on top of that,
Right.
you're going into the forefront of this pandemic, and you're also the top twice as most likely to die from this pandemic. Isn't that incredible?
Yeah.
Janet?
Yes, I mean, that's so true. Like you look at the essential workers, the mailmen, the mail women, Amazon drivers, nurses, housekeeping, people like that. My son, he works at Home Depot. He's putting his life on the line going in, and he's an essential worker. So the majority of us, Black, brown, we are performing these roles, and we're putting ourselves at risk. And another thing I like to say is, we need access to proper PPE, whether it's the grocery store clerk, the nurse, the janitor, the housekeeper, we need proper equipment to do our job.
I wanted to ask you, ladies, what type of things you advocate for on Black Nurses Corner and why? And, what made you want to start this page, this initiative on social media?
I'll let Janet answer that.
Well, my friend Shondra, we see eye to eye in a lot of issues. And it was actually her idea to start this Black Nurses Corner. She asked me to be a part of it. And I have to tell you, I had feelings of trepidation. I'm social, but not that social, kind of laid back. And I knew that this would be putting ourselves out there. But when I looked at the numbers, the health disparities, the poor communities, how could I not do it? We want to make sure we empower our viewers, our followers to advocate for their own health issues. If that's saying, you know what, doc, I really am sick and you're going to see me today. or, my mother's sick, my grandmother's sick. We want to empower our followers. We want to move towards health equity, not just health quality or equality, health equity. So this is what we're doing.
And I know it's hard nowadays for people to chuckle a little bit because of what's going on, but you both use humor in order to pull that message forward. And I really love that and enjoy that about your posts. So thank you for doing that.
Oh, you're welcome.
I'm glad you get out humor.
I wanted to ask you ladies, if you both can propose something that can slow down the rates of things like COVID-19 from affecting Hispanic and Black people at these fast rates, what would that be? What would you propose can help this growing rate of dying people of color?
Well, this is one thing that I find very interesting. With all of the talent, all of the entertainment that comes from New York City, I see that there has been things that was done for communities of, say, like healthcare. What I would like to see is some of the big names in New York City to start passing out PPE, use their voices to get people masks, to get people proper gowns and get them gloves on their jobs. You have essential workers who look like us, who essentially need to be protected, who also need to be heard. They should also have the opportunity to shop when they need to have access to fresh fruits, to have access to vitamins. I want to see people kind of empower our essential workers to not only go to work, but also balance and be able to take care of themselves after work. So part of that is having the proper equipment, like Janet mentioned earlier.
So the heroes that we all praise and applaud are not feeling protected still, even through this entire pandemic. And how do you feel about that? Just being called the healthcare hero and a person that's on the front lines, but you don't feel that in your heart, right?
Right. You know what it is? We feel like we're doing our jobs. This is what we want to do. We need what we need to do our jobs. Do I feel that we get the necessary, not praise, but just acknowledgement? Like, you know what? You're showing up. You're here. You're taking care of this person with COVID. I'm OBGYN. We may have a new OB come in. The mother is concerned about COVID. I just think that we need to just be more out there. I just came across an article on my Nurses Economy magazine where it said a nurse is going to be the new face in social media, TV, things like that. And I believe that we should be, to get our message out there. Like, we're nurses, but we are a part of a bigger healthcare system. So I just think that we need to have our message brought to the forefront.
And I don't necessarily think that we're heroes. I think what they see us do now in times of crisis, we've always been this person. It may not have been to this magnitude, but we've always been healthcare givers. We've also been healthcare providers. We have lives, we have families, we have loved ones. And when they call us heroes, I'm like, we're not heroes. We're doing our job. This is our job. This is what we were, quote unquote, called to do. This is what we were supposed to do. So I don't necessarily think we're heroes. I think I love nursing. I love people. And most importantly, I love us. And I want us to come out of this with a sense of knowing, with a sense of empowerment, and with the foundation to say, you know what, not on my watch. This will not happen again. And I will advocate for better access, advocate for our healthcare providers to listen to us. So I don't want it to be as if we're heroes. I want it to be as if we're educating and we're empowering.
Shondra, Janet, thank you so much for your time today. I know you both work hard and, you dedicate a little bit of time for us today. So thank you.
Oh, you're welcome. Anytime. Yes.
Thank you for having us. I appreciate it.
Pleasure speaking to you both, and thank you for sharing this wealth of knowledge. Everybody, please go follow Black Nurses Corner on Instagram and stay connected with Shondra and Janet. Please stay tuned. BXRx will be right back.
Who's most at risk for coronavirus? People over 65, people with underlying medical conditions like heart disease, chronic lung disease, asthma, diabetes, people undergoing cancer treatment, and people with weakened immune systems. What should you do if you or a loved one is at higher risk? Avoid close contact with people. Avoid crowds. Stay home if you can. Wash your hands frequently. Learn more ways to protect yourself and others at coronavirus.gov.
Welcome back to Open BXRx. COVID-19 has had a disproportionate impact on low-income communities in the South Bronx, and Mott Haven community members have been advocating for the needs of the seniors, children, and families who have been impacted by this pandemic. Joining us now are two of these advocates, Ramona Ferreyra, social entrepreneur and founder of Ojalá Threads, and Althea Stevens, Department Director of Community Affairs at Eastside House Settlement. Hello, ladies, and thank you for joining us today. One of the first things I wanted to discuss with you both is just about the needs of Mott Haven and how you're each advocating for a community. Can we start with you, Althea?
I am the department director at Eastside House, and so my job is really to be the ground, on the ground doing community affairs and trying to seeing and assessing the needs of the community. So we have been doing food giveaways at all three of our community centers 2 to 3 times a week. Also at the request of families. We serve over 466 families in the Mott Haven section of the Bronx. And so we've been doing a lot of outreach to those families to see what their needs are and connecting them to services in addition to anyone else who's in need. So we are not just limited to our people who are participating in our programs. We're also trying to expand that thread of whoever's in need. How can we help? How can we be of service?
And Ramona, can you also tell us about the outreach that you do and the advocating that you do over in Mott Haven?
I normally do work focused on criminal justice reform, public transportation, and public housing. Since COVID began, I've begun to focus on public housing because of the pre-existing conditions within NYCHA. When NYCHA first saw the COVID situation in the city, they started using modern means to communicate with folks. So they were using texting, phone calls, social media, so Instagram, Facebook, and Twitter. And in this community, the majority of people have very low connectivity, including myself. I didn't have internet in my house until Optimum started offering the 2 free months. Up to that point, I depended either on the public library or hotspots that I would connect to for free, including like the NYC kiosk. We also know that a lot of the people that are in this community, their phones happen to be Obama phones. So they change their numbers regularly. They don't move their number or change their number in the office. So we don't know who really NYCHA was reaching. And they don't normally have email. So while NYCHA saw an increase in how many people were using the app, we know that 400,000 are not. So that means that a huge population of residents missed out on critical information in the beginning. Did you want to add something, Althea?
Yeah, no, I just wanted to interject because I think that it's important that we highlight the parallels between what's going on in NYCHA and then talking about what's going on in education, right? Because we're talking about how NYCHA transitioned to this virtual world and kind of reaching residents that way. But the same thing is happening in our school system right now. Because of COVID-19, the response was, we're just going to do virtual learning. So we had all these students saying that we're going to transition to virtual learning. And then when you talk to, or when you hear at these press briefings, the mayor and the chancellor are talking about how virtual learning is going so well. But from a lot of the wellness calls and the outreach that we've been doing, there's a lot of students who don't have access to all the things that you just talked about, Ramona, right? Yeah. So we found students who didn't have laptops or tablets, or if there were, they would have their families who have 4 and 5 children and they have 1 laptop and all the kids are expected to use that. Then we found out that there were a lot of students who are in shelters who don't have access to Wi-Fi at all. So even with our efforts to try to get them tablets and laptops and things like that, they're like, well, we still can't use the Wi-Fi because the shelter won't give us access.
Right. Can we lead into your community efforts respectively? For both you, Ramona, and you, Althea, you're both leading these efforts in the Mount Haven community to get this technology and this access, these resources to both seniors and children and families. Can you both just tell me about that work that you've been doing?
One thing that became critically important for the seniors is that while they are isolating themselves, a lot of them still depend on homemates coming in. And homemades are not being equipped with safety devices, from masks to gloves, by their companies. And for those that do have the means to purchase them, you can't find them anymore locally.
Yep.
And the delivery times are so lagged behind that we have cases of seniors that were infected by their homemades. And now we're thinking that the ones that have died because of that. So we started looking through social media, bringing attention and asking people that had been fundraising and getting masks for medical personnel to start donating excess to us, because now we know that medical personnel is being properly equipped, at least in certain communities.
Why are homemades not looked at as medical personnel? Like they're
seen as disposable.
Right. That's what I'm saying. Like, I think that that's like insane.
This brings up the point that you were making. Like in the conversations that I've started to have now, yes, we're looking for you to donate masks. But at the same time, what I said was, I'll take a mask now, but long term, what we need to be looking at is how do we get them reusable masks? Because I cannot give them a single use. I need each senior and each resident at Mitchell houses, because most of the people here are still having to go outside. So how do I get them each a reusable mask so that they can wash one when they get home and have an alternate one for use? And then even further down the line, going back to what Althea raised, is the city needs to start coming up with a response plan that isn't a one size fits all. So my background in disaster response, the first step that you're supposed to take is assess where the community was before you respond. And I think that the failure we're seeing in the South Bronx and in places like Queens is that when the city started giving instructions, they were giving instructions and designating those instructions in a way that makes you assume that we were all starting on the same level.
Right.
And we were not, right? So our community...
But that's how they've always operated, right?
And I think this goes to even a longer conversation of what does the city look like 2 years, 5 years, 10 years from now? And that equity that we need to start talking about is making sure that when the first testing sites are put up, they're put up in the community where we have the highest rates of asthma.
The bulk of the deaths are concentrated in the South Bronx, but all of the testing sites are in the North Bronx, and they are at sites that are not accessible by public transportation.
Yep.
So then how are people supposed to get there? So for me, I think it's exactly what you're saying. And to add to your point around, we're talking about what does equity look like in the long term? Like, I think we've been able to kind of push things under the rug because we didn't have this pandemic. But for me, COVID-19 is only shedding light on things that's been going on for way too long. So
we've been yelling about these things for a very long time.
We have.
Yelling about, the fact that seniors needed access to a home that didn't have a leak. Because I'm still getting leaks in grandma's apartment. We don't have hot water today. Our elevators are still breaking down.
Yeah, they still don't work.
These articles are being put out stating, Bronxites are twice as likely to die from this pandemic, from COVID-19. So now, what are the socioeconomic? What are the issues that are affecting us in the South Bronx that need to be rectified in order to avoid this, right? And the work that you're doing is super important, but it's also something that you've been doing even before this.
Every single one of my elected officials has been extremely quiet through all of this when it comes to what's happening in my community. It has been mutual aid networks that have come together. So La Morada just called me and said, hey, we are joining the World Chef's Kitchen. We want to come to Mitchell. The instructions that they're getting from the kitchen is you deliver the food to people that cannot leave their homes. So that's something that I know is needed by at least 300 people at Mitchell houses.
No, absolutely. Because through our calls, I mean, it's interesting. I mean, I got an email from a school official the other day because they hear we were giving food out at the community centers. And they're like, listen, like, this is a real story. We have a mother. She was in the hospital. She was diagnosed with COVID. She has 2 small children. Mm-hmm. She can't leave the house. The kids are in another room. She can't go out shopping. They need food. And so for me, I'm like, well, we don't do deliveries, but she's like, where is the service? Who can I get help? So I've been like hitting people up, trying to find ways to get them food. But it is so true. Like, that is something that's not being talked about.
Even in this crisis, when people from the outside come, if they don't connect with the people that have been working in the community, that can tell you where the need is and how the need needs to be fulfilled and how it needs to be communicated to the community, the need's not going to get filled.
If there's one instance going on, then that means it's going on at a bigger level.
That's just one you know about.
It's not isolated, right? So for me, this is just one story of, I'm sure, of 100 other families who have sick parents, who have elderly people, and they can't leave their house. And so how are we servicing those needs? So it's those things where it's like, what are the solutions? And I think I want to bring something up that Ramona had said earlier, where it was like, where is the assessment of like the community needs, right?
It hasn't been done.
Right, exactly, right? We know that the Bronx has higher asthma rates, higher obesity rates. This is not a secret. No one can say like, oh, we didn't know, like we had no idea. This is not a secret. So for me, how did the state and city government sit back and say, well, let's look at these numbers and really see how do we serve these communities, because the disparities are going to be there.
And then the mayor's first response to the report saying that it's Blacks and Latinos that are dying and that they're dying in the Bronx was, we need to start a new ad campaign. And I'm like, my man, you have been showing New York City Department of Health ads every single day. And if you've been doing that every single day since this began and you're not seeing a change, then you need to reevaluate if that is the correct way to reach the people that you are not reaching.
But let's also talk about how the bulk of the essential workers actually live in the Bronx, right? So these are the people that are actually out there in the front lines, right? These are our cashiers at the supermarkets. These are our home health aides. These are our bus drivers. These are our train workers. And these are the people who are out there still to this day on the front line. So it's like, okay, we need to make sure that they have additional services, right? We should have gotten double testing sites. We should have gotten more services, more food distributing. Like, I mean, the fact that we have tenant association presidents in the NYCHA residents, they've been the one giving out the food. You know, I want to give a shout out to them. Like, we have resident association presidents that have been out there 6 days a week giving out food. Like, Danny Barber literally unloads that truck over there on Morris, and he actually has a U-Haul and delivers it to the different developments in the Bronx since this started. So it's like, where's his relief coming in? Who's going to come in and take over for that for him? Like, we have people on the front lines, and God forbid he gets sick. Now what? What's the plan? And for me, I have not heard a plan about like, what's next? How do we support each other and what this really looks like?
Glad to have both of you ladies here, because community-led efforts is where all of this is coming from. This help and, you know, disseminating this information to folks who need it the most. I just wanted to touch upon, Althea, the distribution of the laptops and how you were able to identify with East Side House Settlement, the 30 students in the Mott Haven school that needed this tech ASAP.
Like I said, we service about 466 elementary school students in the Mott Haven section. East Side House has a host of programs, but those are the ones that's in my department and my portfolio. And so from our wellness calls and reaching out to families, there was about 30 students who either had multiple children and only had one device, or they had nothing at all. So we found that the bulk of our students who were in shelters or in transitional housing didn't have anything. And then we also found other students who there were like 3 or 4 kids in the house and they had one device. And so especially with the Google Hangouts and with the way the teachers are doing it, they have very specific times they're on and then they're off, and that's it. So it's been very difficult. So it's funny, me and Ramona were having one of our sessions where I was like just kind of telling her, and then she was the one who actually, I won't lie, who started to ring the alarms in the community around like, hey, we got these kids, let's get this done. And so I had already reached out to folks, and Eastside House was working with some of our foundations and our board members who also was on the ground trying to figure these things out. And so as of right now, we were able to find Eastside House between the board and our getting some funding from some other places, we're able to buy. We actually bought and actually got donated about 20 tablets. We're still working with some other community partners to get the last 10, but even the 20 is going to be a big relief. But like I was telling a couple of folks before, our kids in the shelters, we spoke to the parents, we reached out to them, was like, hey, we got the tablets, we can start picking them up. And they were like, but we don't have Wi-Fi, so what are we going to do with them? So it's just like, I feel like you solve one problem and then it's like the next layer. Because I was like, with this free spectrum and da-da-da, they were like, well, in the shelter, you don't have access to those things the same way you would in your apartment. So now I'm trying to get a list of those who are in the shelter who are having trouble getting access to Wi-Fi. And then I'm bringing those to the elected officials, like, these shelters are in your district, and I really need you to figure out how to get Wi-Fi capability to all these children who are in the shelter.
What we need to understand as a community is that the things that Althea and I are bringing up are not things that are new.
Right.
What we need to look at is, who are we putting in office? How long are they there? And what tangible deliveries are they making to our community? Because there's no reason in 2020 why any child in New York City should be staying in a shelter or transitional housing and not be able to get online. How are they supposed to handle transitional housing, insecurity of home, insecurity of food, the trauma of not having stable housing, constantly having to change and deal with change, and on top of that, not being able to perform with the same tools as their peers? How do we have millions of dollars invested in looking at what helps someone cope and succeed, and no one in the city has thought every single family shelter should be equipped with internet?
And having access to computers, right? Like, I know some of them have like computer labs, but at this day and age, you don't have like a laptop cart where kids can like check things in and out. Like, right. So I think that those are those things where no one ever even thought about.
Thank you for your time. I got to wrap us up because of the time. I wish we had more time to discuss all of these important and pertinent issues, but we at BronxNet are definitely following up with all organizations, community members just like you, and leaders who are doing their part during this pandemic. So we'll definitely be talking about these other issues soon come. Thank you.
Stay mad.
Have a good one.
And to keep up to date with Althea and Ramona, you can follow at Althea_Stevens_D16 and follow Ramona the Mona to keep up to date with these community leaders and their efforts for Mott Haven during COVID-19. Open BXRx will be right back. For weeks now, frontline healthcare workers have been protesting nationwide over shortages of personal protective equipment for doctors and nurses amid COVID-19. A protest took place here in the Bronx in front of Montefiore Medical Center, urging the federal government for PPE now.
We need PPEs, and we need PPEs now in order to protect ourselves, to protect the patients and our families.
We're running short, and we need our healthcare workers to be able to do the job effectively and safely.
A Montefiore nurse took to social media after feeling she was exposed to COVID-19. She is now urging that the incoming protective equipment also be properly sized. Montefiore did not immediately respond to our request for comments.
I observed nurses with very small faces wearing a very large N95 mask, and I saw gaps. You know, those masks need to be like almost sealed into your face so that nothing can come in and out. It's important for me to take precaution in order to protect my coworkers, in order to protect anybody that I may be in contact with, thinking that I'm COVID negative, when in fact I was directly exposed. I didn't have a mask that fit me appropriately, so there is a possibility, and I don't want to take any chances.
Another licensed practical nurse who works out of a facility in New Jersey and prefers to remain anonymous tested positive for COVID-19. She feels that the lack of PPE is more common in private facilities versus city hospitals, and like many other healthcare workers, she fears returning to work after contracting the virus.
If you were like a private facility or a smaller facility, the equipment wasn't ready available right away. Like, I know now that they have everything, but in the beginning, once the quarantine started, we were underprepared. We didn't have enough equipment, and this is pretty much why most of the nurses in the beginning got sick. The fact that I'm scared to go back to work kind of questions if, like, this is really what I want to do anymore, only because I fear for my children, not for myself. I feel like it'd be selfish for me to say that I don't want to go back to work because I'm scared to die, because that's not what it is. I'm scared to bring something back to my family.
Reporting for BronxNet, Sonyi Lopez. Welcome back to Open BXRx. With most people barred from visiting patients in hospitals and many patients tragically suffering and dying alone due to COVID-19, New Yorkers have banded together to create an initiative called iPads to Hospitals, aiming to bridge the physical gap between sick or dying patients and their loved ones by organizing the donation of iPads to hospitals in need. Joining us now to tell us more are Kaplan and Sheneara Musthaq of iPads to Hospital. Thanks for joining us.
Thanks for having us.
The first thing I wanted to get into, firstly, I'd like to say I just really love this initiative. And I first saw it on New York Nico's Instagram, a video that he posted. So kudos to you for putting this together in our city, and thank you.
Thank you. And we're very happy to have Nico on the team. He is he's an acquaintance to the industry. And when I told him what we were up to, he's getting involved in much more than just posting about it. He really cares. And so we appreciate him spreading that word. Absolutely.
So glad. It's all about community. So the first thing, what made you all start the iPad to Hospitals initiative here in New York?
Yeah, so I think I can speak a little bit to that. So this initiative was started at SUNY Downstate College of Medicine by two of my classmates. I was really lucky to get involved into the initiative in the really early stages, but it was kind of started by my two classmates who saw a need in two different sectors, I guess. So one was volunteering to call patients who were in the hospital who had been tested for the coronavirus. And when they tested positive, they called the patients' families to go over, kind of what that means, what are like the quarantine instructions for the families, and what the visitor restrictions were. And kind of noticed that it was really off-putting to families to hear that they couldn't go see their loved ones when they were, alone and sick in the hospital, and some people very sick. And then on the other side, another one of my classmates was speaking to an ER physician who on the healthcare worker side was just really devastated by seeing all these patients in the emergency room alone, and kind of unable to communicate with loved ones. So just coming from those two sides, it was, this idea was kind of born out to, use technology and use iPads to kind of bridge that gap in communication.
And that was something that about 8 or 9 days ago, which feels like a lifetime in the scale of what we've been doing, I caught wind of that very effort happening. And since then, as a group, of very dedicated volunteers, we have all grown this thing into something that is continuing to react to the demand that we're being told explicitly from hospitals that they could very much need. So as we kept seeing hospitals needing those units, we just kept growing our infrastructure, which we still are.
Can we talk about the process behind acquiring the iPads and getting them from the donor to the hospitals?
For sure, yeah. We're accepting donations in a variety of different ways. The lifeblood of this concept was the idea of that thing that you may have in your drawer or in your closet that is of no use to you anymore being of this life-changing use to somebody in need. So we're all about used donations, and we're collecting those in the 5 boroughs through volunteer drivers and a contactless pickup solution. And we are also having people donate these iPads to us from all across the country, which has been an amazing thing to see. So a lot of used iPads in the mix. We're also fundraising for dollars on GoFundMe. We're just shy of 20,000 as of us having this conversation. And we've locked in pricing to be able to get iPads at roughly $100 a unit. So we're using donated funds to be able to also buy refurbished iPads. And then we're also in touch with corporations who may want to get involved and get some of their older iPads in the mix, So there are all of these different ways that we collect them. We bring them together, we log where they all came from, and then we kind of divvy out based on the demand of that day where we can best send them, and we drop them off to our points of contact at the hospital.
I saw it on your website, the reasoning why iPads are the device that you're going with, but can you just tell our viewers why?
For sure. Yeah, we to be sure, we are accepting if somebody has a Samsung or an Android tablet, they can reach out to us and we can make use of anything at this point because the demand is so high. But iPads best ensure the success of a connection because they have FaceTime on them already. If you have an Android tablet, there's no FaceTime, which is still usable, and not everybody has an Apple product, you know? So we don't want to be exclusionary, but we're putting our weight behind Apple because we can get the best results from it.
Got it. And now, how many iPads have you been able to donate so far?
We have been able to donate, I guess with today's, we're at 130 that we've dropped off to hospitals. We have just about 200 more that are in the mix right now that are either on their way to us or being processed. And those hopefully will be in the hands of hospitals very soon. So that number is growing more and more each and every day too. So we're very excited. At the same time though, we are nowhere near reaching the demand the hospitals asking for these in New York City alone. We will always be chasing that demand while we're in this current crisis.
Right. Can we also talk about the importance of targeting underserved communities and hospitals with less funding with this initiative?
Yeah, absolutely. Sheneara?
Yeah. So, this initiative started at Downstate, and, we wanted to make sure that we were targeting mostly publicly funded hospitals where most of the dollars that are being, directed are going towards more healthcare delivery, more so than having the kind of extra like technology available. So, we wanted to make sure that we wanted to make sure that we're fulfilling that need. So, we are targeting these hospitals because the patient populations as well might not have the devices with the capability of video chatting. And then on top of that, the hospitals might not have the technology available to fulfill that need. So we wanted to make sure that we're stepping in there first. And additionally, we found that these hospitals that are serving kind of who are serving underserved populations are the ones that are kind of being most affected as well. So we see that because of kind of secondary health problems like air pollution or socioeconomic status, that there's a lot more comorbidities that are making these populations more susceptible to the virus. So while these hospitals have maybe less resources, they're also getting hit the most with the greatest patient population. So that's kind of why we chose this demographic.
Got it. And now about the nurses and doctors and how they're reacting to the donations that you're bringing to these hospitals. Can we just hear a little bit about that?
Yeah, and I think it would be helpful to hear from both of us because I, up until a week ago, had nothing to do with this world, and so obviously I'm impressionable, but I also am not used to it. And I can say from the outside, it has been humbling and overwhelming to hear the appreciation coming from people resonating in such a universal way, in such a way that really I can't help but feel tied together to these people, and it's a beautiful thing. And it's tragic, and I wish we didn't have to be doing this, but it is an incredible thing, and the response has been overwhelmingly appreciative.
Yeah, I would definitely second that. Unfortunately, as a medical student, I haven't been on the front lines at all, but I've been, I have a lot of friends and colleagues who are, and just the physical toll is, is almost equal to the emotional toll that it's been taking on a lot of healthcare providers. So just to feel like they have to take care of these patients in terms of their healthcare, and then also have this added level of, being the ones that are facilitating communication in this time is kind of unprecedented, really. So, they're very appreciative of this idea coming out and for us fulfilling these orders. And yeah.
How can people join the cause to donate and get involved with this initiative?
Well, our website is www.ipadstohospitals.org, and you can find everything that you need there, our mission statement, our objectives, a link to donate your used iPad through a Google form submission, and also a link to donate dollars if you have any to spare to our GoFundMe. Any amount counts. Those are the two potentially most direct ways to help. But in general, if you don't have an iPad to spare and you got to hold on to every dollar you have, we completely understand that. Spreading the word is completely free. And that is another huge way that people can help us. Folks like New York Nico with a big audience, but folks just talking to their friends and family, it all makes a difference to spreading the word. Absolutely. And I would like to also say that we are completely open to suggestions from healthcare workers. Our ears are open. If they are out on the front lines and they are seeing a way that our efforts could potentially be better focused on resolving an issue, we're always receptive and we're always listening. So I would encourage anybody to reach out with feedback.
Ian, Sheneara, thank you so much again for spearheading this wonderful initiative.
Thank you very much.
Folks, again, to see how you can help and donate to the iPad to Hospitals cause, please visit ipads2hospitals.org. OpenBXRx will be right back.
Why should young people care about the spread of coronavirus? Well, we know that people with underlying medical conditions over the age of 60 are at highest risk, but they've got to get it from somebody.
So we're asking everyone to be selfless for others so that we can protect those who are most susceptible.
Not going to bars, not going to restaurants. It all just means physical separation so that you have a space between you and others.
For more information on how you can social distance, please go to coronavirus.gov.
Welcome back to Open BXRx. The U.S. Census results help determine how billions of dollars in federal funding flow into states and communities each year. And now more than ever, it is evident that the Bronx needs funding. How are Bronxites participating in the census, and what can you do to make sure you and your family count? Joining us now is Jeff Behler, Regional Director at the U.S. Census Bureau. Thank you for joining us, Jeff.
Thank you for having me. It's a pleasure to be here today.
First, can we just learn a little bit about the U.S. Census? I gave a little description, but just give us your professional definition.
Yeah, absolutely. So once every 10 years, as mandated by the U.S. Constitution, Article 1, Section 2, we have to conduct an enumeration of the people for the purposes of representation and funding. And that's what the census is. It's taking a snapshot of our nation, what our nation looks like, how many people are living here, the characteristics of our nation. We do that once every 10 years, and that's what a census is.
Jeff, I'm curious about the participation so far in the census here in the Bronx. Can you give us a little bit of information on that?
Yeah, so we're doing very well, actually. So New York City is in the low 40%, lower than national average, and some areas are in the Bronx are doing low. We are struggling, or lower. I don't want to say struggling, but the Woodlawn, Wakefield, Williamsbridge areas. But a promising story is Co-op City. Over 50.4% of the households in Co-op City have self-responded. So there's some really good news stories that come out of this, especially since New York City is in the heart of the COVID-19 pandemic. And with whether people are leaving or, they're just so tuned to COVID-19, or they're turning everything off just to, shut themselves away from hearing 100% discussions on COVID-19. I think this is a great start to the census. We have some time, which is a really good thing. And what the tools that are available, and everyone can go online at 2020census.gov. You can see how the Bronx is doing on a daily basis. We update every day just after 3 o'clock. You can compare it, look at track level, you can look at county level, and of course, see how we're doing compared to other states.
Jeff, can you talk about the importance of taking this time in quarantine to fill out the census?
Yeah, what a better time. So I've certainly heard from people that during these times of quarantine and isolation, that they feel powerless. And I can't think of a better way to support your health professionals, your emergency services, your first responders, these essential employees, than to fill out your census. Make sure your community has enough hospital beds, that community services are receiving enough funding, that there's enough emergency service personnel representing your community, just that there's enough ambulances or firefighters or police officers. The way to do that is to fill out your census. So there is power to be had. Every household in the Bronx if they take the opportunity, take about 10 minutes to go online, visit 2020census.gov, call one of our toll-free telephone numbers, or households across the Bronx are going to start receiving a paper questionnaire if they haven't filled it out yet. That'll continue. The mail out of that questionnaire will continue through the end of this month, end of April. Please take the time to fill it out. And once you're done, please text everyone in your phone book. Call the people you worship with or your coworkers and tell them why it's so important that the representation of the Bronx, that the funding of critical programs that'll come into the communities throughout Bronx are based upon numbers that we collect in the 2020 census.
Let's say for some reason an individual didn't receive that questionnaire in the mail. Can they still fill the census out?
Yeah, best thing to do is to go online at 2020census.gov. As soon as you land on that page, you'll see in the upper right corner a little button called Respond, and you can click on that button. Now, one of the important things we sent out in the beginning, if you didn't get a questionnaire right away, we sent out an invitation letter to go online. We gave you your census ID. It's just a 12-digit unique identifier that takes place of your address. So that when you go online, you enter that ID and we automatically know the data you're about to enter. When we release it at the city level or the county level or at a neighborhood level, we're releasing it in the right place because it is powerful data that's going to be used to determine representation and funding for the next 10 years. So our job is to count everyone once, only once, and in the right place. But if you don't have that ID, you can still go online. Right below the area where you enter your 12-digit ID, there's a little link that says, I don't have, or if you don't have your census ID, click here. You click on that button, an address screen will pop up. We just ask that you key in your address of where you live, and then you can go on and enter in your census information. So it truly is easy. And if you don't want to do it over the internet, we certainly understand not everyone's comfortable with that. Online at 2020census.gov, if you click on how to respond, you'll see a list of 13 different telephone numbers, one for every language that we support. Call the toll-free number. A census personnel on a federal employee on the other line. You call the Chinese line. Someone who speaks Chinese will pick up the phone and immediately begin conversing with you in language, answer any questions you have, and then collect your information. So we're trying to make it as easy as possible for people to respond.
And now, Jeff, for those with security concerns, how has the census ensured that information is never compromised?
Yeah, great question. And that's part of our census conversation when we say the census is safe. So every piece of data that we collect is protected under federal law. And a lot of people don't realize that. There's a Title 13 created in 1954, basically states we can never release information at the person or household level. So when we release our data, it's at the state level, at a county level, at a city level, at a census tract level. It can never be at a person or household level. Local, state, federal law enforcement can never access our data at any time for any reason, period. That means Homeland Security and ICE can never access our data. Even the Patriot Act doesn't supersede Title 13. The Census Bureau has been taken to federal court numerous times over the past 7 decades. People challenging us for very good reasons, trying to get our data at the person level, and we have won every time. There has never been a breach of Title 13. In addition, everyone who works on a census, whether it's your permanent employee, whether you work for a 4-week operation, you take an oath of confidentiality, and that oath is for life. If I were to release information that would identify an individual or household, I'll be fined up to $250,000 and imprisoned up to 5 years. So we know that the public's trust is the foundation of getting a complete and accurate count. So people can feel confident in telling their family and friends and neighbors and coworkers and those that they worship that the census is safe.
And just an emphasis on what filling the census will help bring to the Bronx community.
Yeah, when you think about first off, let's talk about representation. That's extremely important. From the number of seats that New York State will have in the U.S. House of Representatives, that's important. If we don't get a complete and accurate count, New York State stands to lose additional seats in Congress, and we don't want that. At the local level and the state level, states will use this data for their redistricting purposes, for drawing school districts, for drawing voting precincts. Businesses are going to use this data to determine where they want to grow. They want to go to places where there's a customer base or where they will have the ability to hire people to work for them. So businesses use this data all the time, but it really comes down to the funding. When you talk about hundreds of billions of dollars of federal funding that are disseminated to communities throughout the Bronx every year based upon formulas that use census data. Medicare, Medicaid, food stamps, and the TANF and WIC programs. You talk about education, whether that's classroom size, the number of teachers, technology, school supplies, transportation getting kids to and from school, ensuring there's enough parks in the community for those kids to go to after school. We talk about healthcare, and now during this COVID-19 pandemic, ensuring you have enough hospitals and hospital beds and emergency personnel. Also higher education with Pell Grants, community block development grants, so communities can use this information, improving transit systems and roads. All this is so important. And I'll never forget, and I wish I could remember her name, a community board president in the Bronx gave this wonderful she was defining to her community members what an undercount means to the community. And she said, imagine you have a school of 100 kids in your community. Let's say only 80 of those kids get counted in the 2020 census. For the next 10 years, that school is going to receive 80% of the funding it deserves. And it doesn't just affect those 20 kids who weren't counted, it affects everyone. Now apply that to whatever's important to you in your neighborhood, whether that's care for the elderly, whether that's improving transit, making sure there's enough firemen and policemen available, ensuring you have enough hospital beds. All right. If we don't take action and fill out the census and ask those around us to fill out the census, we risk the possibility of losing funding and not getting the right representation for us for the next 10 years.
Very important. There you have it, folks. Please fill out your census. You just heard it here, how important it is in order to fill it. And we can't stress that enough. Jeff, just to close out, can we have those links again?
Yeah, best thing to do is go to www.2020census.gov. That's where you can fill out your 2020 census. You can see the telephone numbers. And we have materials in 59 languages. We have language guides and videos. So there may be language barriers in certain communities in the Bronx. Great opportunity to learn more about it, to share the message, to learn how to fill it out, and then to send that to everyone you know.
Thank you again, Jeff, for your time. Regional Director at the U.S. Census Bureau, Jeff Behler.
Thank you very much.
Folks, if you haven't filled out your census yet, it only takes 10 minutes. Please visit 2020census.gov and click respond to start the quick questionnaire. That's all for our show today. Thank you again for tuning in to BXRx. I'm your host, Sonyi Lopez, wishing you and your families safety and wellness now and always. Until next time.